There's one experience that every single one of us is going to share, and yet it's pretty much the last thing any of us wants to talk about: death. It's a topic that's just wrapped up in fear and taboo and silence. But what if we could actually change that? What if we could learn to talk about it openly, maybe even productively? Well, today we're going to dive into a brand new field of study that's designed to do just that. So let's just ask it outright. Why is this so hard? I mean, the fear around death is totally understandable, but that silence, it can be really counterproductive for our mental and emotional health. A new academic approach is trying to carve out a space for education, for open conversation. So how do we actually get better at this? Well, believe it or not, the answer might be found in the classroom. Okay, so this new field has a name. It's a bit of a mouthful: pedagogy of death. But you can just think of it as death education. And the goal here is not to be morbid or depressing, not at all. It's about creating a safe, supportive space where we can explore what death means, its impact on us, and how we grieve. The whole idea is to build understanding, empathy, and, emotional resilience. So, if this is a new and growing field, what are researchers actually talking about? I mean, how do you even study a taboo? Well, a recent study decided to tackle that exact question by creating a map of the entire academic conversation. It gives us this incredible bird's-eye view of how we're learning to talk about life's final chapter. To build this map, the researchers basically became information cartographers. They used this really powerful method called bibliometric analysis. I know, it sounds super complicated, but it's really just a way of analyzing huge amounts of published data, in this case, scientific articles, to see who's writing, what they're writing about, and how all of their ideas connect to each other. And this slide really gives you a feel for just how massive this undertaking was. They started with a pool of over 1 million documents. A million. From there, they started filtering, zeroing in on articles specifically in the field of education published between 2010 and 2023. And after all that meticulous work, they were left with 276 core scientific articles that became the foundation of their entire map. So what did the map actually reveal? Well, the first big takeaway, and this might be the most important one, is that this isn't some niche topic just being whispered about in university hallways anymore. Nope, the academic conversation around death education is getting a whole lot louder. Just take a look at this trend. Back in 2010, there were only 7 relevant articles published. Fast forward to 2015, that number more than doubles. And then by 2023, it surged all the way to 41 articles in a single year. This isn't a slow trickle. It is a clear signal that something is happening here. There's a growing sense of urgency in the academic community. And then you see this number, 684. What's that about? Well, in the world of research, this is like a massive vote of confidence. It's the number of times these core articles were referenced or cited by other researchers in 2023 alone. In science, a citation means your work matters. It means people are building on it, they're debating it, they're taking it seriously. So this shows the field isn't just growing, it's becoming really, really influential. So where in the world is this conversation happening the most? The data points to 3 clear leaders. Researchers in China, the United States, and Spain are publishing way more on this topic than anyone else, which suggests a really significant focus on death pedagogy in these countries. But why the big surge in interest now? This quote from the research paper offers a really powerful clue. The global experience of the COVID-19 pandemic, which brought death and grief into our daily lives in a way we hadn't seen before, it seems to have been a major catalyst. It's like it awakened this new urgency among both educators and researchers to finally address this fundamental part of life. Okay, so we know the conversation is growing. Now let's get back to the map itself and see what it actually shows. The analysis found that those 276 articles weren't just a random jumble of ideas. No, they all clustered together into 5 distinct neighborhoods, 5 key areas of focus. So the first neighborhood on our map is all about adolescents. And just look at the keywords that pop up here: depression, anxiety, fear. This tells you right away the conversation isn't abstract. It's about directly addressing the very real mental health challenges that young people face when they first grapple with mortality, whether it's losing someone they love or facing a serious illness themselves. The research here is all about giving them real tools for communication and resilience. Next, we move to a cluster that's focused on young children. This is all about how to find the right language, the right support to help kids navigate grief and anxiety at such a tender age. And not surprisingly, you see COVID-19 listed as a key term here. That really drives home how the pandemic forced these incredibly tough conversations into homes with even the youngest family members, making this area of study more urgent than ever. Our third cluster takes us right to the front lines of care, nurses. This research is so vital because it digs into the immense emotional and psychological toll of caring for dying patients day in and day out. It's asking the really tough questions like, how does this constant exposure to death affect them? And how can we better prepare and support them for what is absolutely essential but incredibly difficult work? And closely related to that is a cluster all about end-of-life care. Now, if the last section was about the caregiver, this one is about the care itself. The focus here is on the practical side of things, in hospice and palliative settings, to make sure people have dignity, comfort, and compassion in their final days. It's all about improving the quality of life, right up to the very end. And this final cluster, it might just be the most fundamental one of all: training. This is about educating the educators. Because think about it, if we want to get this right with kids, and with teens, and with patients, we first have to make sure our teachers, our social workers, and our healthcare professionals have the tools and the confidence they need to guide these conversations. This is really the foundation that makes everything else possible. So, we've walked through the map, we've visited its 5 key neighborhoods. But what's the big picture here? Let's zoom out and talk about why mapping this conversation is so incredibly important and what it really means for all of us. This slide just sums up the entire mission perfectly. The old way of dealing with death, defined by fear, by taboo, by isolation, it's not working. It's counterproductive for our health. The new way, the one proposed by the Pedagogy of Death, is all about shifting to a model of education, of empathy, of resilience. It's about moving from silence to conversation. And this isn't just theory, right? This is a practical blueprint for change. This research gives schools and hospitals the actual evidence they need to build better curricula, better training programs. It gives all of us a path to start destigmatizing these conversations in our own lives, in our own communities. And the ultimate goal isn't just to talk about death more. It's to foster a society that is genuinely more compassionate and more resilient when we face life's greatest certainty. I think this quote from the study just says it all. The ultimate vision here is an education system that doesn't shy away from reality, but instead prepares us to face both life and death with the tools we all need: understanding, empathy, and emotional resilience. So I'll just leave you with this final thought to chew on. If death is a universal part of the human experience, something every single one of us will face and be affected by, shouldn't learning how to navigate it be just as fundamental as learning our ABCs? Something to think about.